or I'm sorry, for the City of Spartanburg. And he has been working on this project for a little bit longer than I have, I think since 2014, Chris, is that right?
At least 2014, maybe.
At least 2014, when he was the assistant city manager. He's since been wisely promoted to city manager. We also have Barbara Minowski here on the line, who, when this all started, she was the head of a program called Quality Counts at Spartanburg County First Steps, and she is now the head of Spartanburg County First Steps. And as a wealth of knowledge, one thing that we joke about on this project a lot is that when the period of development for the project involved her having 6 grandchildren while we were building this out. And then we have Caitlyn Watts, who's here from Hello Family itself. She is the sometimes called quarterback, sometimes called coordinator. I call her guru and person who keeps me sane. And she's the one who spends all day, every day looking at the full picture of Hello Family. So with that, I think I'm turning it over to Chris to kick us off. Is that right, Chris?
That's fine, yes. And I hope we'll all sort of tag team the key points, but I'll begin with sort of where the journey that resulted in the Hello Family initiative, how it began. We started a discussion a number of years ago in Spartanburg about reaching the aspirational goal of doing what the evidence says we should in this community to support the children of the city reaching the schoolhouse door, thriving, healthy, and ready to learn. That prompt came from a decade's worth of education initiated primarily by the Mary Black Foundation, which is a long-standing partner of the city and funder that had adopted as a priority of their work early childhood. And so over time, they even got stodgy, thick-headed bureaucrats like me to understand the science and the evidence base and the underlying socioeconomic rationale for communities prioritizing that space for interventions. And what we found in our discussions is that oftentimes this is a community space that no particular institution perceives itself as fully owning. And there's a role for local government, there's a role for the healthcare providers, there's a role for the public education system, and others, but there isn't a default understood line of sort of community accountability associated with some of this work, and that's what created the space in which Hello Family could take root. Hello Family is a suite of services, a set of interventions within an umbrella, and so I sort of sometimes describe it as two things. It's an information and data and referral portal, and a funding mechanism for a set of interventions that were needed in our community, some of which are brand new to Spartanburg, and some existed here, but with the resources under the Hello Family framework, we're able to take them to scale for city families. So that's really what Hello Family is. We're trying to simplify a complex landscape by giving one number to call. The shorthand way we've been describing that is, one magnet to get on the refrigerator, one relationship to start with the parents and caregivers, and hopefully allowing for resources to be targeted to families in need. So we're focused on improving birth outcomes and early childhood health and development. We want to reduce avoidable emergency room visits We want to reduce the incidences of child abuse and neglect, and increase school readiness. Within Hello Family is the region's first local government participated pay for success transaction, and Brian will help us unpack that a little bit later in the session. But that was interesting and important to us as we were trying to work through what comes with asking a local government to broaden its mission, which is essentially what we've done here in the city. In Spartanburg, we've considered ourselves to be a community that valued public health and education, but we've obviously had a long way to go on that front. But certainly, if you'd asked us a decade ago whether we thought the city government would be a funder of early childhood supports and services, the answer would have been a resounding no. So one of the benefits of the collaboration we'll describe, and the structure we'll describe, and the pay for success financing tool has been, they have added comfort and provided a practical, pragmatic line of sight for local elected officials to enter a whole new realm of services and supports. So let's go. Who's got the? I don't know who has the slides, but
I'm the clicker.
Oh, great. And Brian and Caitlyn and Barbara, y'all certainly, as I try to cover these first few slides, you guys correct and amend and jump in, and the more voices, the better. But we're tracking a lot of data in Hello Family. Some of the data we're tracking is tied to the pay for success payments, and other data that we're tracking we think is just relevant to the conversation, but not necessarily tied to payments. But among we want to increase child and maternal health, increase breastfeeding, increase family stability, increase educational attainment, reduce preterm births and low birth rates, reduce C-sections, reduce child maltreatment, reduce infant emergency room visits, reduce maternal depression, reduce behavior problems, and reduce education, welfare, and healthcare costs. And of course, all of that data is collected in a mechanism and structure that Brian will touch on later.
Well, and before we get too far on that, I do want to give the community a shout out for how they approached selecting those. So some of you may be familiar with the North Carolina Early Childhood Foundation's frameworks for early childhood. That's essentially a survey of all of the research literature on what moves the needle on, I think in their instance, things like third grade reading. But Spartanburg took a similar approach. They looked at, from that flag on the hill, so to speak, that Chris just mentioned, of every kid showing up healthy and thriving and ready to learn at the schoolhouse door. We worked together to sort of backtrack that in the evidence and see what all of these things that you're seeing here are leading indicators of that. And so we went through the assets that were already in the community, the services and programs that were already there, and looked at their research basis, and then also identified a couple of gaps where, so when we were identifying the existing assets, like what we could bring to scale, and then identified a couple of gaps for things that we should bring in. And so the overall suite of services reflects that work that took, a significant amount of time and attention to identify. And then the four that we're talking about most today are the four that had strong enough evidence that we could build a financing structure around their results. So these are not things that were pulled straight out of the air. The community identified the flag on the hill, and then the community assets informed the leading indicators that we're working on.
One of the things that we felt was important to advancing this Hello Family was making the case for why the city of Spartanburg. I know that most folks know that Spartanburg is in the upstate of South Carolina. It's a we're in a rapidly growing region, and we're in a county of 350,000 people. We've got nearly 20 new people a day moving to the area. But the city itself is the urban core of that region. And we have some daunting statistics related to child well-being and intergenerational poverty and structural challenges that come with what I call the legacy cities of the Southeast, urban cores that have existed for quite some time and struggled with those challenges. So we did some case making and had to engage a lot of folks that were regional service providers, county level service providers, about why the city of Spartanburg, as opposed to working through a larger geographic footprint. And of course, the data is a key piece of that. Our high percentage of children living in poverty, which is a statistic that haunts us all. And our other community partners came to the conclusion that both for need and for scalability, working at the city level first, and don't get me wrong, most of what we want to do with Hello Family needs to be done at a county or larger level, absolutely. But if we can be the population that proves the benefits can be yielded and harnessed by smart interventions, all the better. You know, we'll prove it, and then hopefully our partners carry it out outside our jurisdiction. That's just simply more data along those lines to show that Hello Family is designed around where the region's most acute needs are.
And we have a question here in the chat about what motivated the decision to include non-white population in that slide instead of a demographic breakdown of populations under the non-white category. And I think for this particular slide, it was just space. But that, you know, when we were doing the deeper dive, we definitely had breakouts of demographic breakdown within that non-white population. Thank you, Terrell.
And then of course, I've always included this because this is sort of how I got to this understanding of why a community plagued with entrenched intergenerational poverty needs to prioritize investment in the earliest years. And so this is part of that early education that the Mary Black Foundation and other partners have provided to myself and dozens of community leaders in Spartanburg about the importance economically and otherwise of investing in the early years. And what we're trying to do here, which sits within a broader systems work structure through some other cross-institutional initiatives. We've, you know, like a lot of communities that lack resources to do all they want to do, we've found that if we can collaborate across institutions, we can create systems level change. So when we break it down and you see the heavy level of investment and participation from a wide number of community partners, you see that, you know, why some of us hope that this type of outcomes-based financing, orientation around data and evidence and systems level change can provide a victory, a template, a framework that makes similar initiatives that may not have anything to do with early childhood, but are attacking other challenging problems. We think Hello Family can make it more likely that those systems level bold efforts can be implemented across institutions in the future.
When we were talking earlier about how within that overall suite of fellow family, that first research dive identified maybe a dozen, 15 different interventions that could be brought to scale to move that needle. One of the four that coalesced into the ones that we could really build a financing structure around include things that address these needs. So in-home assessments for nurse home visiting, essentially, intensive education and parenting programs for high-risk families, high quality care and education, of course, and education and culture change for young families as they work towards their own family's journey towards healthy, thriving, and ready to learn. So within that framework, there are four interventions that I think I'm going to pass now to Caitlyn, who has been working most closely with them over the last several months to talk about those four.
Hi, everyone. So the first one is Family Connects, and Family Connects is new to Spartanburg County. Hello Family funding is the reason why. So they actually just got started several weeks ago, and it's going great so far. But Family Connects is a nurse visiting, home visiting program. So every mom who gives birth at Spartanburg Regional and lives within city limits is offered a home visitor, a nurse to come and check in with you in the first few weeks to do some assessments, see what you're doing, how you're doing, and then also to connect you with any of the community resources that can benefit you or your baby or your baby. So those are going well. Again, they do a few different assessments, and then they will do a few more follow-ups via phone if needed. And then the next one is Birth Matters. And Birth Matters also is working with moms starting in pregnancy, less than 24 weeks. You will be paired with a doula, and then that doula will partner with you and support you throughout your entire pregnancy, through your birth, and then through your child's first year of life. So they're not only, go ahead.
I'm going to pause you real quick because there's a question relevant to that. On the prior slide, we talked about support for high-risk moms, and the question was, how do you define high risk? High risk was not so much a defined term as a summary of, in this case, Medicaid eligible moms who are under 24 years old. And so that's high risk is just a shorter way of getting at that in conversation. But go ahead, Caitlyn. Sorry to interrupt.
No, that's fine. So where Birth Matters is focusing on moms who are Medicaid eligible, Family Connects, just to clarify, is for any mom within city limits. So that way we are still trying to reach everyone regardless of income. Again, Birth Matters stays with you. The doula supports you throughout your child's first year. So, and it's not just focusing on the baby's health. It will also focus on, do you need help getting a job? Let's look at that. What about your education? So they truly are acting as a full support system for moms who otherwise might not have anyone. And Birth Matters is based on a healthcare model as well. And then the next one is Triple P, and Triple P is available for all families regardless of socioeconomic status, and they are providing parenting help. So the great thing about Triple P is it comes in all different levels. So it might be where you pop in one night for a seminar, which is a 90-minute session where they're giving you great tools and helping you understand a little bit more about your child's development and tools and tips and tricks you can use. But then also if you need, a little bit more, a deeper dive, they can do one-on-one levels with you as well to really look at your specific situations and how they can help you through that. And then the last one is Quality Counts. So I'm going to punt to Barbara because she is the one who helped bring this to Spartanburg.
Good morning. So last week, Quality Counts celebrated its 10-year anniversary. This program, actually began as a pilot in partnership with the Mary Black Foundation. And it is quality enhancement to create those high quality early care and education learning environments. And we all know research tells us, don't need to preach to the choir, that those little baby brains need every little bit of those good verbal interactions with the people who care for them the most. They need high quality care, they need high quality education, all happening at the same time. So Quality Counts, we never dreamed would grow as it has. It has actually expanded across our state. 5 other counties are engaging in Quality Counts. But as Chris mentioned earlier, our county is growing. new businesses are coming in. And so the demand is greater. We can't keep up. So this timing of this project is perfect for us to be able to meet the needs within the city and just keep growing it the best that we can. Thank you, Caitlyn.
Well, and I have to give another shout out to Barbara here. I think it was in 2015, you were presenting at the Smart Start conference about quality counts. And we started talking shortly after that. And ever since then, I have reframed whenever I talk about brain science. You know, we often talk about serve and return, but she was breaking it down from her work in developing quality counts to this. It's not just, you know, a tennis analogy. It's positive, reciprocal, verbal, face-to-face interactions with safe and familiar adults. To the extent that you have that, you have everything else gets easier. To the extent that you don't have those ingredients, everything else gets harder. And so ever since 2015, I think maybe every other conversation I'm in, whether it's about early childhood or not, I manage to say positive, reciprocal, verbal, face-to-face interactions with safe and familiar adults at least once. And I blame her, and so does my wife, who has to endure that over the dinner table.
That is very true. And Brian, you know what? A shout out to all of you, including Chris. And one of the biggest coups I think we've had is the fact that Dr. John Stockwell, the former chancellor of the University of South Carolina Upstate campus, just a brilliant man who lived in higher education all the days of his life. And during the course of this project, you know, he now says, I thought the answer always lived in increasing the opportunity for higher education. And he is now one of the biggest fans of investing in the very beginning in these projects. So yay for everybody in Spartanburg that's bought into it and believes it.
And I do think that this frame around those positive interactions is part of the cultural shift towards creating self-reinforcing systems that will help us achieve kids who are help the kids arrive at the schoolhouse door healthy, thriving, and ready to learn. And so I guess that's a good place to turn to how we measure that success. So partly because of the emphasis on the financing structures. So we're going to talk about the financing structure in a minute in more detail, but it does require rigorous measurement, and it also requires that we manage to those results. And so that's led us to a twofold evaluation design. One is on stuff that we're very accustomed to measuring. It's fidelity metrics, it's program completion, it's enrollments, it's families served, it's Eckers and Itters ratings and that sort of thing. But we're not looking at those as ends in and of themselves. That's really for us to have an early warning system for, oh, hey, we're on track, or oh, hey, we're not on track for things like healthy birth weight, reduced ER visits, reduced substantiated cases of abuse and neglect. We're reducing substantiated cases of abuse and neglect on a systems level, and I could just jump. Reducing days in NICU, and of course, kindergarten readiness. So for the fidelity metrics, we've got the Riley Institute is our validation partner from Furman University. For the impact outcomes, we're using, and if anybody wants to get into this, I would love to go on a down the rabbit hole with you about synthetic control methodology. We're using a quasi-experimental design based on that methodology to create a counterfactual, and it's fantastic. If we have any evaluation geeks in the audience, so feel free to pop that in if you want to talk more about that. But our evaluation partner for those outcomes is the Urban Institute, and they're using administrative level data. So that has helped us a lot with not burdening the families that we're helping with a bunch of complicated and difficult forms to fill out about consent and whatnot. We're just using state level data that's de-identified, measuring the whole population's movement on these outcomes versus the counterfactual that's synthetically built. So, and I am checking the chat real quick. I'm not seeing anybody jumping at that one. Okay. So the funding model that we're using, oh goody, Lizette would like the evaluation resource. Lizette, I'll follow up with you with an email of the evaluation design. So the funding model is, as we've discussed, and thank you, Kelly, we'll follow up with you as well, is a pay for success structure. So this is over about 5 years to serve the entire city of Spartanburg, is about a $9 million project. And about half of that funding is provided through upfront sort of traditional philanthropic capital. And about half of it is financed through a pay for success structure. And that is where, let me actually hop on to this next slide. If you take out a traditional loan or a bond to pay for something, you're usually paying it back based on time passing. So there's some schedule that says every month you make X dollars payment. This is a loan that's, instead of being paid back based on a time schedule, is paid back on an outcome schedule. So there, for every kid who the rigorous evaluation says is born with a healthy birth weight that we would not have expected that, or for every reduction in substantiated cases of abuse and neglect, or improvements in kindergarten readiness. Every time one of those things happens, there's a payment made back to the lender. And so this is a way for government to contract, not for, button seats time, but contract for kindergarten readiness, or contract for healthier births. And this was, as Chris was talking about earlier, this was a real concern. This was a real asset for a city government. A small city government in the South is often expected to, maintain roads and Main Street and sewers and traffic lights, et cetera, et cetera. There's a heavy emphasis on the built environment. And there's less of an emphasis on, little kids being ready for school, but they have huge opportunities to improve those outcomes for kids. And so we needed a way to be able to sort of, to address concerns from constituents or the press or whatnot, that, hey, cities aren't necessarily good at this. How can we trust that this is a good investment for the city of Spartanburg? And through this type of structure, they're able to say, well, if it doesn't produce the results that we're expecting, we're not paying for it. So we have, and I want to put a plug in here for 2 organizations that have been critically helpful for us building this. One is the Sorensen Impact Center, which helped us think through how to structure the finances. And then of course, Maycomb Capital, who is our impact lender, who's providing about half of the capital for this to move forward. Both of those organizations, if you ever have a chance to work with either of them, take that chance. It'll be a good experience. So the government has contracted with Maycomb Capital to provide that upfront funding and pay back those loans based on the impact. And the service providers then get a steady, reliable funding stream, so they don't have to worry. So Barbara's not trying to figure out the interest and et cetera, on this mechanism. They experience this in some respects more like a traditional grant. Is that fair to say, Barbara? Have we? Yeah, okay.
That's completely fair to say, yes, which makes it so much easier. Absolutely.
Okay. And so that's the high level overview of Pay for Success, and happy to go more into any of the details of that either now or later as anybody wants. And I will say that we're continuing to get stuff in the chat about sending along the evaluation design, and we'll definitely do that. Oh, and I jumped ahead a little bit, I think, and already talked about some of this. One of the questions in the chat is, what was the funder? It's the Community Outcomes Fund at Maycomb Capital. And we'll have that up on the slide in a few minutes, but it's MAYCOMB. One note that I'll add here is Pay for Success, when it was originally sort of conceived, one of the reasons it gained in popularity was there are a lot of instances where governments have money that's kind of tied up in remediation. and so it's hard to move towards prevention or towards upstream investments because they're spending so much money paying for the problem that was created later because they couldn't pay for that preventative work. And so one of the neat advantages of the evaluation design of this financing structure is that we're going to have really hard-nosed knowledge about how much money we're saving things like Medicaid and TANF, as well as the human impact that we're all driving for. That hard-nosed data on those types of metrics is really important when we're trying to sustain these programs long-term. So we'll reach the end of this project in 5 years, and rather than saying, hey, state legislature, we promise that if you help us fund this thing, we can provide some real cashable savings and some real important outcomes. Rather than having to go to them with that pitch, we can come to them and say, hey, for the last 5 years, here is the amount of money we have saved you. And here are the outcomes that the community is experiencing that they would not have experienced. Now, you can either keep getting those results and keep getting that savings for pennies on the dollar, or you can shut it down and not fund it. And that's a much more compelling case. One question we're getting here is, I'm just going to read it out. And so the local government contracts with MACOM, and then the service providers receive it more like a traditional grant. That's essentially true. The caveat I would say is that this particular project has about 30 organizational partners between the funders and service providers and the evaluators. And so the way that we did that to avoid trying to negotiate a contract with way too many people was the Institute for Child Success is a nonprofit, nonpartisan organization. We're sort of the hub of a wheel of contracts. So most of the 30 partners have a contract with ICS. So we have taken the loan out from Macomb Capital and we've entered into a contract with the city, and we've entered into a grant agreement with First Steps. So that's the legal structure of how that works. But in the spirit that you mean it, yes, the government has agreed to repay a loan from Macomb Capital based on outcomes, and service providers are receiving it more like a traditional grant, with some more emphasis on those outcomes in the regular check-ins and the grant management process than you would see in a traditional grant. Just a quick note on some of the 30 partners. So the way that the financing came together was we had significant donations from several organizations. So 1.5 million from each of the City of Spartanburg, the Duke Endowment, and the Blue Cross Blue Shield Foundation of South Carolina. Or sorry, that's a typo, it's the Blue Cross Blue Shield of South Carolina Foundation. And then 1 million each coming from the Mary Black Foundation and an anonymous local philanthropist, which is awesome, and Spartanburg Regional Healthcare System Services. The lending partner, for those who asked earlier, is listed here, the Community Outcomes Fund at Macomb Capital. Again, they're awesome to work with. And then additional funders include the State Health Authority, so DHEC, the State Medicaid Agency, which is DHHS, the 2 school districts that serve the City of Spartanburg, the Spartanburg Academic Movement, which is a Thrive model, the South Carolina First Steps Office, which is the parent organization of Barbara's organization, Regenesis Healthcare, which is a federally qualified health center, the Sorensen Impact Center, which we mentioned before, and ICS. Just real quick, I'm seeing some additional questions here. And so this question is the idea being that because the government isn't spending money later on reactive interventions, they can pay back this loan. That's the traditional way that Pay for Success started, I would say. And that was especially true for recidivism work. And that's part of the sustainability element, is that we are demonstrating savings to some levels of government, including the Fed and the state level especially. The City of Spartanburg, I would say, isn't capturing this in the same fashion, and they're not approaching this from the same perspective. In this case, for the city, and Chris, feel free to correct me if I'm getting this wrong at all, but it's more about accountably delivering the results that they're looking for. So they're not necessarily achieving savings in a short window anyway, on things like reduced preterm birth, because the city isn't a a major funder of preterm birth health outcomes. Now, I would say that they will be reaping some savings from this in 20 years and some economic output in, well, shorter than that, but it's not, that's not the mechanism that this particular pay for success design is built upon. Chris, how was that? Anything you want to add to that?
No, I mean, I think just to be, more direct on the question, that politically, when you're trying to get a new endeavor done with a public body in a space they've never ever entered before, being able to transfer risk to those who know that world better has real value to the process. In other words, we know we need healthier, stronger, more stable families, and we know we need children who are more prepared to thrive in this world. But we know that people like Brian and Barbara and Caitlyn and everyone else listed on this slide knows the mechanics of that far better than we do. And so when I go to the mayor and the city council and suggest this new plank of work, this new line item in our budget that's never ever been there before, transferring that risk away from the city such that our exposure is from a practical matter limited to the success of the interventions, has great value in getting that done. And so what we've done is we've put our contribution aside, and if for whatever reason Hello Family results aren't where we expect them to be, that money can then subsequently be reallocated to some more conventional role for the city. I mean, maybe it's a playground or two that gets built or something of that nature, so that has value at the policymaker, public official discussions.
There's a follow-up question here. Are the community partners held accountable to pay back those funds as well if outcomes are not met? And that's a key question. And the answer is no. So the way that this works is that the governmental funders who are repaying the loan, they only repay the loan to the extent that outcomes are achieved according to that outcome schedule. But the service providers like Quality Counts and First Steps, they are not financially on the hook if those outcomes aren't achieved, which is necessary because nonprofit organizations, I imagine many of you either work in or run nonprofit organizations, they don't have a balance sheet where they can absorb that risk. So the whole purpose of this, as Chris was saying, was to transfer the risk of success not being realized to folks who have both the financial and the expertise, the financial resources and the expertise to judge that risk and manage that risk and absorb that risk. And so folks like the Outcomes Fund at Maycomb Capital are funded by investors who want to, they want to make a return, but they also want to do good in the world while they're making that return. And so this is their way of doing that. And so it's something of a win-win-win-win-win. Government gets to achieve the outcomes that they want. Service providers get to have funding that they can plan around to deliver their services. Investors get to have that double bottom line return, and the kids and the families benefit. So I hope that answered your questions. Feel free to keep them coming either verbally or in the chat as y'all have. Caitlyn, do you want to talk about the hotline and the fridge magnets?
Sure.
Diaper stickers.
So the other part of this, aside from the providers, is how do you reach the families? How do you reach all families in Spartanburg if they don't need one of these specific services? So the way we did that is we created a hotline via the hellofamilyspartanburg.org website. And we're trying to do it in a way that meets parents where they are. So if they are, as Brian says, breastfeeding at 3 a.m. and they just want to scroll to see something, they can do that. If they want to get in touch, they can, which a lot of people typically take that route and just saying, okay, I don't even know where to start with this. And then they can also search, through findhelp.org and search by zip code to see what's around them. So we have a lot of different options here as far as for parents to see what's around them, what's available to them, what are the costs associated with that. And then also just to be able to find someone live at the other end of the phone. And we don't guarantee to always have the answers, but we will find someone who does. So we've helped families from everything from just trying to figure out how do you even get a voucher for my child to my child just got diagnosed with autism and I have no idea what any of this means. So sometimes that's somebody else on the other line going, I have no idea what this means. Let me go research it too. So we learn as we go on this as well, but it's definitely something for parents that we're promoting and marketing out in the community so they can easily find some help and just feel supported as well.
And it's also so we talk about these services as reinforcing one another, in part because of sort of the time where they're catching the families. So we have the prenatal space with Birth Matters, the postnatal space with Family Connects and Birth Matters, Quality Counts, which spans birth through 5, and Triple P, which really spans birth through 8, but more especially 3 through 8. And so we want families who are who connect with us, when they're breastfeeding a baby at 3 a.m. to then be like, oh wow, now my kid is 3 and my job situation has changed and I need help identifying quality childcare and near my new job. We want them to be able to keep coming back to that same one place and getting connected to the resource that's most appropriate for them. And so that's one of the elements that we're most excited about is creating not just a structure that watches the full field of early childhood to drive towards these outcomes, but also a structure where families feel like they can reliably access those resources along and get the support that they need. So we have a little bit of time left, so we're right on. I believe we're right on schedule. Additional questions and concerns or ideas are welcome. I see one additional one here. Those 3 resources on the Hello Family hotline are available to city residents, correct? Or also surrounding counties. So the Hello Family structure, the broader one that includes the 12 or 15 services that are driving towards this, that is serving Spartanburg County. The Pay for Success financed expansion of those 4 services to bring them up to full population scale. That is emphasizing the city population. That said, the hotline accepts calls from the full county. And I don't know if we've received any from Cherokee or Union, but I imagine we wouldn't say, oh no, you don't live here, go away. So it's a comparatively small population. But Caitlyn, what's been the geographic distribution of the calls so far?
All of them are Spartanburg except one who was in Union County, but she lived in Union County, but she was right on the line. So pretty much her life is in Spartanburg. But again, like Brian said, wherever you are, if you're close by and we can help you, and even if you're far away, we'll connect you with anybody we know to help. Yeah.
This next question from Carrie Ann is, how did you start/advocate to convince your city to sign on to the Pay for Success model? Was it one-on-one relationship building or targeted advocacy? And before Chris gets started, I'm going to give him a little more credit than he would probably claim for himself. These conversations really started probably you can draw their genesis back till about a decade ago when the city and the Mary Black Foundation was partnering with an organization called Way to Wellville to build healthy communities. And for as long as I have been in this space, the city and the Mary Black Foundation leadership has been meeting with ICS every week or every other week through good times and really rough ones, continuing to persistently move this forward. And so I will say that of all the communities that we work with, ICS has staff in 8 or 10 states. We work in a dozen jurisdictions at any given time. And while we love all our jurisdictions, Spartanburg has a unique level of social capital amongst its partners and trust. And this comes from a real intentional emphasis on trust building with partnerships. And so I give huge kudos to Chris personally and to the city government for really driving this forward in the first place. So they were bringing everybody else along in partnership with the Mary Plaque Foundation. So Chris, now that I've bragged on you, you can give the rest of the answer.
Yeah, you are very kind, but it ultimately comes back to that we've got a city council that is really interested in long-term strengthening of the community and very willing to take that longer time horizon that it takes for some of these things to mature. In fact, my former boss, who was in the role I have now, created time and space for us to look at some of these long-term intergenerational poverty issues, and that was very deliberate, conscious effort to say, we're always going to have 1,000 immediate things, potholes to patch and problems that we must react to, but within the organization, we want to carve out time and energy and resources to look 15, 20 years out and be thinking about those things. So it's really a culture. And then the fact that we ended up with Hello Family and early childhood being the sort of flagship under that frame I was just referencing has a lot to do with the Mary Black Foundation's presence in the community and their persistent and consistent education on the importance of early childhood. So they had sort of created the soil conditions that this could grow out of when the city council was ready. And we're just fortunate to have some good partners that were willing to stay at the table when we confused the heck out of them when we started talking about pay for success. But they stuck with us, thank goodness.
That is all very true. They were very patient with us. There were a few times where in our weekly check-ins we're like, well, they keep coming to the meetings about the broader community. So we were concerned that we were pushing them away with techno jargon, and they kept showing up. And I think that goes back again to the trust. Following up on that a little bit, I'll say that I think one of the exciting elements of this project is that now that we've built this somewhat complicated structure of reinforcing things that can drive towards kindergarten readiness and lots of other improved outcomes, that thing that we built is scalable and transferable to other communities for sure. If they see it and they say, hey, we want that, it's pretty straightforward to say, okay, these are the ingredients that you need, these are the funding levels that you need per kid, and we can help you with that. The thing that I'm enjoying sharing the most is what Chris just talked about spending 5-10 years treating this like you would treat an interstate project or a major downtown development. Those projects aren't 6-month projects. Those are projects that you start planning with the Chamber of Commerce 10 years ahead of time, and that's the sort of time scale you pay attention to, and you build the trust with the partners along the way. And I think that's the most exciting piece to show off, is how the same mindset that you would apply towards that type of project can really drive long-term systems level change for families in a community. Let's see, more questions here in the chat. How do you determine when services will be available explicitly to city residents, county residents, etc.? Is it always dependent on lenders and what their asks are? And then there's a second question there, but we'll start with that one. So the broader structure of services, like the 15 or so, Those are funded and exist now in the way that traditional nonprofit services are funded and exist. So they have footprints that are sort of independent of this pay for success transaction that we're talking about. And then the pay for success transaction layers on top of that and is working to expand to full scale within the city limits for those services. So that's how we determine how things are gotten to the city residents in particular, is as soon as we can ramp those services up to all city residents with fidelity, they'll be available to city residents. We are looking forward to some productive envy and some, additional resourcing of those services for county residents as well, and we're working on that actively. But right now we have funding for the city residents, and we're working to get that going at scale, and we think that will help a lot with raising the funds for other residents. We're also, as an aside, we're also getting some productive envy from other parts of the state who are like, oh, hey, that Family Connects thing sounds really awesome. Can we do that over here? And Quality Counts, I think you said, is now in 5 counties. Is that right? Yeah. So we are seeing some of that expansion already happen, and some of that is already happening as well for the county. But that's a probably longer than necessary answer. Sorry about that. What barriers to expansion have you all identified? So we spent the last 6 years on the financial one, and got that one squared away for the next 5 years. I might pass this actually to Barbara and Caitlyn first to see if you want to take the first bite at these, since you've been closest to the challenges of expansion.
Well, I think for Quality Counts, funding always seems to be the trip, right? Because we can hire more technical assistance providers, but we need funding to do that. I think that is the song that's across the state. If we can get our hands on the funding, we can replicate and we can continue to expand those services. So again, I would say the number one piece would be funding. I do think a barrier that was reduced by this project for us has been this project literally has put a flashlight on early care and education services, gaps, the whole 9 yards, right? All the pieces that as early childhood people, we beat the drum all the time, like the little kid jumping up and down, right? But when you're shakers and movers, you're folks that really can create some traction, when they become believers and they're talking the talk to, you get traction a whole lot quicker. So we have quite a few smaller projects that have popped and we've been able to be successful in. I would say that we're very much an indirect result of this project.
The only other thing I would add is obviously start with the funding, but once you have the funding, you have to have the staff. So what a lot of people are experiencing is they have to go get the staff. So for Birth Matters, you're looking at, several months of training just to be able to become a doula, and people have full-time jobs. So they've actually had a lot of success with it, and they're about to, hire two of the people they've been training the past few months. But then we still have some more people, again, looking for staff. And then once you get the staff, you have to get the families involved. So then you have recruitment as well. So it's very much you break down each barrier at a time and really think outside the box in all those different areas.
And that's the recruitment especially is one of the areas where we're hopeful that the self-reinforcing nature of the structure and of having Caitlyn doing what Caitlyn's doing is really helpful. So, a lot of folks who get into this work don't get into this work because they love running a business. They certainly don't get into it for the money, or because they love running a business. So it's, the recruiting structures are not as intuitive as the program models often. And so having folks who are able to provide that reinforcement and those connections, I think is going to be really helpful. I will also say that the folks who get into this for the purpose of helping families tend to be whip smart and tend to figure out the business side very quickly, and also the recruiting side. So I don't think they give themselves quite enough credit on that front, but it has been really nice to have that overall infrastructure to help reinforce. And in fact, I think one of the organizations that was most concerned about recruitment is like, actually 2 of them are like, okay, no more recruiting just yet. we've got to get the staff trained. Hang on a sec. So that's been nice that the systems seem to be reinforcing each other the way that we were hoping that would. Chris, anything else from your vantage point on that barriers to expansion?
No, I mean, I think that you know, what we expect is that Hello Family run its 5-year. It's all structured around 5 years worth of services that are beginning, and that as we get close to the end of those, some elements and pieces will be sustained, and some will be expanded, and the result will have a whole new data set to share with all the partners. So we recognize that what does Hello Family look like 10 years from now is an open question, both in terms of geography and the specific elements that are within the umbrella and what it might become. We'll learn together.
I think that's right. We have a question here about what are the service numbers. I'm trying to see if I can, it's hard for me to pull up the exact numbers while I'm also presenting. I'm sorry, and I should have these pulled, but I'm going to give you close approximations. So for, and actually, Caitlyn, you may have this better than I do. So for the community doula expansion, we're looking at several dozen additional families per year. For the Family Connects, we're offering Family Connects to all moms who give birth who aren't already enrolled in the community doula model, Birth Matters. And so that's about 500 families per year. Quality Counts is providing quality improvement for basically the entire community through the existing early care and education infrastructure. And then Triple P similarly is a population level intervention for families aged birth or 3 to 8. And that's in part, for those who aren't familiar with Triple P, it has a level 1 that is population level. And then it's tiered in the dosage and intensity of the supports. And so, for instance, we'll have a lot fewer people getting the level 5 9-month program of Triple P than we will having getting the level 2 seminar type work. But we are offering the full suite of that. So I hope that answers the question. But I can also shoot you the sort of summary sheet of that to anybody who's interested in that. Let's see. The next question is, are you integrating service data into a state level early childhood integrated data system and ECIDS? The short answer is sort of. The longer answer is no, but. And what follows that is the state of South Carolina is developing an early childhood integrated data system. They have a remarkable, what we call a data cube, for lack of a better description, that connects several administrative level data systems together. So for instance, you can potentially crunch data on the interplay between Medicaid access and abuse and neglect outcomes, for instance. And so it is really remarkable. It doesn't yet connect non-agency provided early childhood services. And that's something that is an ongoing project with the state early childhood agency called First Steps, which is the umbrella agency of Barbara's organization. So the formal thing that you mean doesn't yet exist for us to quote plug into in the same way, but they are working on developing that, and we're eager to support data infrastructure. The other thing that I'll add to this is that, for instance, Triple P, there are a few Triple P providers in the state, and especially in Greenville County, which is a neighbor, and in Georgetown County, which is in the low country of the state. And through this process, one of the nice sort of unintended gravy benefits maybe is that they have been working to better integrate their data systems with each other as we're working on this project, and some of the infrastructure support that the Riley Institute is providing has been helping with that. So we are looking for opportunities to make sure that data systems are, you know, safe and rigorous and interoperable wherever we can. Let's see. I have a question here. Is this something that can be replicated in an organization that is already driving early childhood initiatives? And then to supplement and further support the work that is already happening? Again, I think the short answer here is yes. So assuming you mean the pay for success financing, or maybe you mean the suite of services there. So feel free to pop in what you mean by that. But I think both are replicable. Both the process for you know, identifying what assets you have that you can bring to scale, and then which of those have the type of data that that would support pay for success financing structure. Both of those things, you know, now that we've done it once, it's easier to do a second time. The key ingredient I would say there is that you have a community that has some intentional energy getting applied towards a common goal or set of goals in this space. So for instance, having a City of Spartanburg or a Mary Black Foundation or some similar partners that are chasing a flag on a hill like that, like the kids showing up at the schoolhouse door, healthy, thriving, and ready to learn. A lot of communities that have a Strive network, I think have already built some of that interpersonal capital and structure. And then on the pay for success side of it, I think where that's useful for folks is where they have their money tied up in remediation, and they do want to they do want to be able to get some flexibility so that they can pay for some prevention work and then fix the problems that they're paying for later. Or they have the dynamic that Chris was describing, where they need to overcome sort of a political or a constituent or a elected hesitation about either why they're getting into it or trusting that this is going to work when it's managed by whatever entity you're talking about. So I think if you have one of those two things, either the tied up in remediation or some political challenge where you need to pay for results, I think that's where the pay for success is really the most advantageous as a tool. It's a little time consuming to build. So if you don't have one of those two things, you probably have the political capacity to fund things that work and manage outcomes. And it might be easier to do it through traditional appropriation structures. Or something like what Tennessee or Ohio has done with outcomes-based appropriations. But yes, we're excited to help communities replicate this for sure. Anything, I realize I've been talking a lot here. Chris, Caitlyn, Barbara, anything that I'm leaving out on any of that you want to chime in on? I'm getting thumbs up from Caitlyn, smiling, shaking heads from Barbara and Chris. Okay. The next question here is, in regards to utilizing Hello Family, have you all noticed a specific program that has been more popular than the rest, measured by enrollment, word of mouth, etc.? However you'd like to measure popularity. I don't think so, and I think it's hard to answer that question in part because these are serving different needs. So one's prenatal needs, one's postnatal needs, one's early learning, one's parenting supports. Now, I will say that I expect enrollment to be highest, perhaps, in the two population level interventions. So Family Connects is meeting every mom who gives birth when they give birth. And so I expect their recruitment to be, high as a result, because you're giving families what they need when they need it so very badly, because they're exhausted and they have this bundle of joy that they have no idea what to do with if they're like I was. And so I think I do expect that one to have a pretty significant market saturation, so to speak. And similarly, Triple P's level 1 is out on the airwaves. It's on the bus stops, or it will be in a few days. Anyway, is it already on the buses? Is the level 1 already on the buses? Not yet. Okay. So that's coming. So I do expect that one to also have a pretty heavy footprint. Whereas the other two are a little bit more targeted, either to enrolled centers or to young Medicaid eligible moms. But yeah, that's a long way of saying we haven't really had a system where we can tell if one is more popular than another. They're all pretty awesome. So, let's see. I think we may have reached the end of the questions. Yvonne, did you notice any that I missed?
No, I think you got all of them.
Okay.
Do you have any final words for us, and your contact information? If you would like to put something in the chat, that would be great.
Of course. I'm putting my email address, which is apparently hard for me to type while I talk. bburrows@instituteforchildsuccess.org. And anyone should feel free to reach out to me, and I can connect you with any of the panelists or any of the other partners. Barbara, Caitlin, Chris, feel free to pop in. And actually, Caitlin, could you pop in, because I can't type and talk at the same time, the Hello Family webpage for anybody who wants to look at that. But feel free to reach out anytime. And I will say that just as a concluding factor, if there's a lesson that I could share with everybody who wants to work on this sort of thing, is that really intentional 10-year look at this as a trust building, systems building enterprise, I think is the thing that has certainly been the most fun element for me about working with Spartanburg, aside from very delicious food in the community if you ever have a chance to visit. But that's been a real joy to work with, and I think this, for various reasons, this project was really hard to build, and it actually died fully a few times, we thought. And then the next week we got back together and we said, okay, so that path failed. So where can we look again? And that dynamic, I think, goes to both the intentionality of the community and also the trust between the partners, so that when something did go sideways, they were comfortable discussing it in a very candid way and problem solving around it. And it's the sort of behavior you get from kids when you give them lots of positive reciprocal verbal face-to-face interactions with safe and familiar adults. And it's been a lot of fun to work with that dynamic with a small group of dedicated people who are changing the world. Chris, Caitlin, Barbara, any last thoughts before we give a few
My
minutes
little
back?
thought would be, if this is really a new idea to you, as it surely was to myself, I can own this. And I was a little intimidated, and the Sorensen group was amazing, as they're just brilliant. I learned so much, and the patience and the respect, and just the developing of all these relationships to a deeper level. It is a major changing event for the community with lots of ripple effects. So don't be afraid to step outside your comfort zone or your little comfort box, especially if you've got a Caitlin, a Brian, and a Chris in your corner.
Thank you, Barbara. All right, I think Terrell may have closed us out here with a note that says, "Success is only a bunch of failures stacked on top of each other." And I'm definitely stealing that line from you. So at some point you need to introduce yourself so that I can know who to give credit to, aside from Terrell from a conference that I was in. So thank you for that. And with that, I think oh, hey Terrell. Now I have a face. So I think we're passing this on to Yvonne for some last logistical pieces.
Wonderful. Thank you so much. Hello, Family Spartanburg, for that wonderful session. So thank you to all of you for your participation in today's session. So we do have a wonderful prize to give away. And this prize is a $50 gift card from Discount School Supply. And the winner is Kim Radcliffe. Kim, can you come off? Open your mic and come on for us for a second.
Hi.
Hi, Kim. Wonderful. Congratulations. You are a winner today from Discount School Supply. Is giving you a $50 gift card for being with us. And so we want to say thank you for attending, and thank you to Discount School Supply for being a wonderful sponsor. And we just love their continuous support. So thank you. And so I want to remind everyone that there is a survey for all of the sessions that you attend today. So it's a daily survey that we will put out to everyone, and I'll post this in the chat as well. But at the end of the day, we want you to take this survey and just go through and complete the information in reference to all the sessions you attend. We look forward to seeing you back. Our next set of sessions start from 1:30 to 3. So we're going to give you a little break in between. Again, thank you. But if you have any questions, please call us, contact us at conference@smartstart.org. Please remember also that the sessions are being recorded and will be posted to our website for your viewing afterwards. So if we can do anything for you, just let us know. Thank you, and we look forward to seeing you again later. And again, thank you for this wonderful session. Enjoy. Bye-bye.
Thanks, everybody. Just making sure there aren't any last questions in the box that come. Not seeing it. Thank you, Yvonne and Ann. Really appreciated it.
Thank you. Bye-bye.
Take care.
Yeah, thank you. We appreciate it. I hope you have a good rest of your day. Bye-bye.
Thank you.
Bye-bye.